Hi, this is Dr. Justin, and today's talk will be on weight loss, essentially weight loss resistance. I see many patients here at the clinic that have issues with weight loss, and kind of just some of the common things that I find that really are kind of the main cause of weight loss resistance. You're kind of on that calorie roller coaster, and every few years you notice your weight keeps on going up, and you kind of feel like, hey, this may never stop. So some of the factors that I find behind that. First things first, inflammation is a very common factor to chronic weight gain. So inflammation, what is inflammation? Well, inflammation is a couple different kinds. Acute inflammation will be something like a cut or a sports injury. So a cut, for instance, your body is going to form clotting factors that are going to produce a scab, and eventually that scab will then heal. That's great. What we find in today's society is we have chronic systemic inflammation. The body is systemically inflamed due to diet and lifestyle factors, and that is causing, essentially stimulating a hormone called cortisol, other hormones too, and other different cytokines, but just to keep it simple for this generalization, cortisol essentially is driving belly fat down, driving hip fat, and actually is breaking down protein and muscle. And it's interesting to note, a lot of the receptors for cortisol are actually right around the bellies and hips. So our real first goal in addressing weight gain is knocking down cortisol. That's one. Alright, so where does cortisol come from? We'll just kind of go over a couple of the few factors that I find in my patients commonly here. So foods. Foods being the first thing that we see the common attribute for inflammation. When you have to do it every single meal, and you're either putting food in your body that's creating an anti-inflammatory state, or you're putting food in your body that's creating a pro-inflammatory state. Okay, that's one. So eating the right fatty acids is very helpful. People are on this whole low-fat kick today. You're not getting the right nutrients in to help squelch that fire. That's one factor. Two, we're eating lots of different food allergens that are causing huge issues. I see that with different glutens and grains, dairy, soy, and actually eating foods that are loaded with mycotoxins. So mycotoxins are actually produced by fungus. And it's interesting to note, farmers will actually put various mycotoxin pellets in the cow that they're raising's ears because they find that the cow will actually produce 30% more of the calorie that it takes in will actually convert to fat, which is very interesting. If you're eating lots of peanuts and different foods, like grains for instance, then you're increasing your mycotoxin exposure, which is going to have a huge effect on you gaining weight overall. Next, the gut. So as we eat these foods, we'll cause all this inflammation around the gut. And essentially we can see inflammation on the skin, we can see a cut, but on the inside we can't really tell what's going on. So when we're eating foods on the inside, we're causing inflammation. When we cause inflammation, a couple of things happen. We have our different microvilli on the inside of our intestines that are little vacuum cleaners that suck up nutrients. So one may suck up vitamin C, some calcium, some iron, etc. So if we kind of clog these vacuum cleaners with inflammation, then we can't really take in a lot of the nutrients that we need. It's important that these nutrients are actually used to run our energy system. So it makes sense if we can't get the nutrients we need, our energy system may be a little bit low. So again, next up, toxins. Toxins are another huge factor that we see. The body is very intelligent. It knows, hey, toxins are dangerous to the organs, dangerous to the brain. It does its best job to sequester them when they're taken in. Sequester meaning it stores it in the fat and keeps it away from going into systemic circulation. So if the body is constantly getting exposed to toxins, does it have a hard time letting go of fat? Because it knows that fat needs to be there to help buffer that toxic exposure. So if we do our best to decrease toxin exposure, mycotoxins, food allergens, etc., we put our body into a huge step of healing and getting better and releasing that fat that maybe there is a safety net, so to speak. Okay, so we went over as a little recap. We talked about inflammation. We talked about some of the foods that are causing inflammation. And we talked about some of the toxins as well. Another common thing we see, super common, is over-exercise. Patients are doing exercise that are actually increasing cortisol. You can check the medical databases that long-distance cardio, especially marathon running, anything that I consider over 45 minutes to an hour, long-term is going to increase cortisol secretions. And again, we talked about cortisol, the receptors around the tummy, around the hips. So at the same time, you're adding on hip fat and belly fat, and you're also burning up muscle. So we like to get people's exercise dialed in precisely, and a lot of times it's not about working harder, it's about working smarter. So doing short bursts, short duration, high amplitude bursts tend to be a much better solution. So overall, we looked at some exercise components, we looked at some food components, and toxin exposure components to how weight loss tends to accumulate. And over time, what we find is patients with a sluggish metabolism over time tend to accumulate weight. So really the key is to address the metabolism, fix it, and it's important that you do not want to lose weight to get healthy. You get healthy and then you lose weight. So it's kind of a different way of thinking. So I hope this video helped everyone here, and any questions, feel free and let me know. We can always set up a consultation. Thanks.